Doctors smoke Camels than any other cigarette. Why not change to Camels for the next 30 days and see what a difference it makes in your smoking enjoyment?
Just as smoking was once sold as a perfectly healthy activity, e-cigarette companies now have managed to convince the masses that they are a safer alternative to tobacco.
Well, the truth of the matter is the trend is just too new for us to know what dangers it may hold. Dangers like the patient from Colorado sick enough to stay in the hospital, or the 3 more suspected cases the state is investigating tonight.
Or the situation in Illinois where doctors are looking into what could be the first death connected to vaping. Tonight, Contact 7's David Clue walks us through a day in the life for doctors treating our newest epidemic.
One set of numbers is already out there, and that's the staggering rate by which teens and young adults are taking up vaping. It has been, as a replacement for tobacco, the perfect moneymaker. However, when it comes to health, researchers will tell you these are following the same trajectory as tobacco just 60 years later.
You can do more of it, you can do it faster, pure. It's basically cigarettes on steroids.
18-year-old Chance Amarada ended up in the emergency room after he says he felt pain in his chest.
It was almost as if I was having a heart attack.
Turns out his lung had collapsed. His doctors are blaming a vaping habit he started about 1.5 years ago.
I didn't think vaping could have that effect on my lungs.
E-cigarettes and vaping have literally taken over tobacco with teens. Record numbers are entering that vapor cloud every day, and doctors like Stephen Thornton are now sounding the alarm.
It's a wild, wild west out there. We've seen individuals who've had seizures after starting vaping where in the end there's no other explanation besides the starting vaping.
And it's not just happening here in Colorado. As of today, the Centers for Disease Control and Prevention has recorded nearly 160 cases of severe lung disease nationwide.
We're seeing all these weird things that we don't normally see with cigarette smoke because of the concentration and the ability to deliver it very, very potently.
Because these cigarettes hit the market so fast, there was no time for research to measure the impacts on the body. That is quickly changing. Dr. Matthias Salaith and his team are among dozens of researchers opening eyes with artificial lungs, vaping robots that are exhaling some truths about what's going into millions of human lungs.
We see inflammation that is similar to tobacco cigarettes, and we see the inability of these cells now to clear mucus.
The machines can test any e-cigarette by simply pulling the vapor from the vaping device and exposing it to donated human cells.
I am worried that people inhale this, and in 10, 20, 30 years, we're going to recognize in humans that we're sort of recreated the problem that we've seen with tobacco. And that is disappointing.
Adding to that disappointment, these damaging impacts are measured even before the introduction of flavors, more cooked chemicals entering those lungs.
It really is a situation where many times you don't know what's going to happen until it happens.
And that could be the scariest prospect of all. You see, most of those doing research on e-cigarettes today anticipate they'll see the same health impacts as they saw with tobacco just decades sooner. I'm David Clue, Denver 7.